Vein disease is a genetic condition that affects the veins primarily in your legs. What it does in the legs is actually affects the valves inside the veins. Every vein in your body has these one-way valves that help push the blood back up towards the heart. Well, because of genetics, they get damaged, and when they get damaged, some of that blood flows the wrong way, or it flows backwards. We consider this reflux. When we do ultrasounds, we actually look for these different valves, these refluxing areas in the veins.
And venous disease is a common disorder. It's seen in greater than 80% of our U.S. population. Majority of the patients, about 70%, are women. 20 to 30% are our male population. The usual presentation is that of a sense of uncomfortableness, heaviness in your lower extremities. Patients often complain of some swelling, possibly discolorations. They may notice varicosities or bulging veins under their skin. Sometimes there's a burning sensation, a sense of itching. Occasionally restless leg syndrome that affects your evening sleep. So these are the frequent presentations of the disease, and there are treatable options available. I think the first thing that we do is coordinate an ultrasound, which will enable us to determine the extent and the complexity of your vein disease. Following the ultrasound, the extent of your disease requires a different approach. Sometimes we manage it with compression therapy alone. Other times, the need for procedures, in particular radiofrequency procedures, which are catheter-based procedures to address your chronic vein disorder. The need for continuation and follow-up is very, very important. It's important to treat the initial disorder. Then we have to determine the progression of this disease that may require or need additional procedures.
One of the procedures that we provide is called a radiofrequency ablation. Basically what that is a small catheter that's inserted inside the vein using ultrasound to guide it, and the tip of it heats up. Before we heat this up in your leg, however, we do numb and make sure that you can't actually feel any of it.
We numb the surrounding tissue prior to introducing our catheter. We use local lidocaine. The catheter is advanced to the groin area. Once the catheter is in position, we inject on 4 or 5 locations a numbing medicine to minimize any pain or tenderness prior to the procedure.
Once the catheter heats up, the vein is sealed, the catheter is slowly retracted, and that vein is sealed completely off. Once that happens, the blood reroutes automatically, and the body just reabsorbs the vein like it would any type of bruise.
It's a procedure that takes 15 to 20 minutes, carrying low risk for complications, done as an outpatient with limited complications. Varithena is a proprietary mixture of polydocanol, which is a sclerosing agent that we use. We inject it into the veins by way of a catheter.
This procedure will entail coming into the office. We bring you back to the procedure room. We look with ultrasound to find the vein that needs to be treated. We'll prep the skin with a cleaning solution, then use a small needle that we will insert into the vein, inject the medicine. Post-procedure, we'll have your legs elevated, and you'll lay for 10 to 15 minutes with your legs elevated. One of the procedures that may be recommended is sclerotherapy. Sclerotherapy involves the injection of a medicine into the veins to help the veins to close.
Varicose veins and spider veins are a common problem presenting as early venous disorder. If you anticipate sclerotherapy of your veins, which requires a very fine needle and the introduction of a sclerosing agent known as polydocanol. This is an agent that is infused into the superficial veins, enabling them to go into spasm, shrink, and scar down. Phlebectomy is a non-surgical opportunity of removing varicose veins. Varicose veins are those unsightly bulging veins that may not benefit from other treatment modalities.
So this will be done in the office. You will be awake. We would offer you a slight oral sedation like a Xanax or Valium to help with any nervousness. Then we would start by prepping the skin sterilely, and then we would numb up the skin using a lidocaine solution.
Each of the area is locally anesthetized with lidocaine. A small incision is made over the vein, and the vein is removed surgically. This takes an average of 45 minutes to an hour, depending on the extent and the length of the vein. We often remove the vein through a tiny hole in the skin, enabling a very cosmetic outcome.